is plain to see with Kate Garraway now on BBC Two with scenes of surgery.
Just imagine we could understand what's wrong with our bodies by actually looking inside them.
Wow, that is something. That's amazing.
This series is all about helping families who, just like mine, are trying to get to grips with health challenges.
It's always there in the back of your mind.
It takes away your happiness.
I just want to know the truth about what's happening in my body.
By bringing people together with state-of-the-art technology,
Let's flip the visors down on our headsets.
we'll let them literally see beneath their own skin.
So let's peel away the bones.
Wow, look at that.
Gosh, I have never seen anything like this.
Is that my prostate? It's like a big haggis.
It's just really incredible to see inside me.
Working with the country's top doctors, they'll have a medical consultation that will truly astonish.
So you can see the healthy uterus here, and this is yours.
Just to say, these are your breasts.
Helping them to not only understand their condition,
That is what's causing your pain.
Oh, really? Oh, truly, that looks startlingly different, doesn't it?
but also make the key treatment decisions they need to get better.
What we'll be doing is removing all of the left lobe.
You can see it's shrunk right down to almost nothing.
Now I can see it for what it is, and I want to get it removed, and I want to be better.
Oh, bless you.
I'll be there for every step
How's my brain?
as we use the power of technology
You're incredible.
to bring hope to our lives.
Knife, please.
I will never see life in the same way again.
So thankful for the care that you and your medical team. Without you, I wouldn't be here today.
This is your health as you've never seen it before.
Quite handsome, isn't he?
Sometimes it's so daunting when you're talking to a doctor to make those crucial decisions, and so tough on the health professionals to be able to build a picture. So I think what's great about this show is that we have the chance, working with your own body, to feel like we understand and have the courage to take a big step to lead them to a better future.
In this series, we're bringing patients together with their doctors in a unique imaging centre where they will have a mind-blowing consultation that helps them get to grips with their condition from the inside out. With the help of consultant Dr. Goody Singh.
So let's have a look at the scan, shall we?
They'll get the ultimate insight into what's going on inside their body.
With the latest technology and augmented reality, we're going to show you your body in a way that you've never seen it before.
First to one of our state-of-the-art imaging centres is Miriam, who's joined by her partner Maddie. Miriam wants to understand more about the painful condition she's recently been diagnosed with and the treatment options available to her. The couple met 2 years ago and bonded over their love of the great outdoors.
She's very silly, very goofy. All right, Miriam's going into Loch Ness.
We like kind of making up funny voices or come up with like silly songs around the house when we're doing the cleaning or something.
But it wasn't long before the unexplained symptoms that Miriam had had since she was a teenager started to really impact their lives.
I went to a chiropractor who couldn't help. I went to like an osteopath who couldn't help. I just wasn't diagnosed by any of the GPs that I saw. They thought that I just needed to lose weight. There are times where I get in the bath and realise I can't even lift my arms up properly to brush my hair because my back hurts or my pelvis hurts or I'm just out of it and really tired. I don't know what to listen to and what not to listen to with my body and what I'm just trying to drown out because I'm in so much pain.
Miriam reached a crunch point when 6 months ago she was rushed to hospital and after half a lifetime of pain was finally given a diagnosis.
Hello, lovely to meet you. Sit down, sit down. When did you first start experiencing the pain?
I've been in pain in some form since I was maybe 12, 13 years old. It's almost like you had toothache, but it was through your body. It's that sort of throbbing dizziness, but yeah, down my whole side.
What is this condition?
So I had been diagnosed with endometriosis. Someone said, you've got stage 4 deep infiltrating endometriosis in, you know, the entirety of your pelvis. And I can't imagine you having this and not being in extreme pain.
More than 170 million women worldwide suffer from endometriosis, a condition where tissue similar to the lining of the womb grows in places like the ovaries where it can form painful cysts. Elsewhere, it forms sticky areas of tissue that can join organs together. The majority of cases are mild, but in severe cases like Miriam's, symptoms of chronic pelvic pain, heavy periods, and severe cramps are difficult to live with.
So when you got that diagnosis, then I suppose the questions were, what do I do about it? And you've been given some options, haven't you, including surgery?
I mean, I've heard from 2 gynecologists that I should do surgery and from 1 gynecologist that I could just try and manage it medically.
But hopefully some knowledge gives you power and hope to be able to have a better life and maybe take some of the fear away.
I think that it might also give me a sense of control, a sense of knowing what's going on, because it's quite scary with endometriosis. You know, you have things explained to you, but I really don't know what's happening inside. To be able to see that and put those 2 things together, I think would be really good for me.
Hi, Miriam.
Hiya.
Would you like to come to the consultation room?
Yeah, let's do it.
Dr. Goody is taking Miriam to see her consultant, gynecologist and surgeon Mr. Shaheen Kazali from the Lister Hospital in Chelsea, London.
Hi, Miriam. Good to see you again.
So these are Miriam's MRIs here, aren't they?
They look quite scary, like quite intimidating, so it'd be interesting to understand them a bit more.
To help Miriam do just that, we've created 3D models of her hospital scans. Throughout their relationship, Maddie has seen her partner in constant pain. She too wants to know why.
So we're going to be able to see Miriam there, and then we will be able to see what she's looking at. Do you feel a bit nervous?
Yeah, a bit.
Yeah.
We want to help you to understand your condition better. So if you're ready, should we put headsets on?
Wow.
Miriam, this is your pelvis. It's made from your scans, and this is what your insides look like.
Wow.
You can walk around and you can see what it looks like.
It's like nothing that I've kind of seen before. I mean, it's intense.
This is so bizarre.
We want to be able to explore this. And so to be able to do that, I think we'll take those pelvic bones away. So let's do that now.
So this is showing the main pelvic organs, your organs. So on the left, you'll see the bladder.
So that's this bit.
where,
Yeah.
yes, that's where urine is stored, that one, yes? And then next to it is your uterus.
So it's this bit here.
Okay. On top of the uterus, those white bits are your ovaries.
Wow, okay.
And between the ovaries and the uterus, you'll see the fallopian tubes. You see the things that are leading to the ovaries.
Wow.
What you're seeing here is your uterus and your ovaries.
It doesn't look like the drawings that you would expect.
Yeah.
And I mean, I don't know if that's...
Good or bad?
Yeah, exactly.
Yeah.
Shall we have a look at what a normal, healthy uterus looks like?
Yeah, definitely.
So you can see side by side now, there's the healthy uterus, and this is yours. Take it in.
Oh my gosh.
That looks really bad.
Your uterus is larger and has a different shape to a normal uterus.
Well, my first thought is I have a mutant uterus.
Miriam's ovaries are more than 5 times larger than the average and have been pushed out of place by multiple cysts growing inside them.
Your ovaries are completely fused to the top of your uterus. If you come over here, you can see that these two ovaries are almost touching.
Yeah.
We call them kissing ovaries, okay, because they are so close to each other right at the back of the uterus.
I'm just a bit taken aback because it's weird to know that you have something inside you that looks that wrong.
To imagine that's what she's been carrying inside of her for who knows how many years, and that nobody found that. Like, it seems impossible that nobody realized.
Endometriosis can be difficult to diagnose because the symptoms vary so significantly.
Patients with endometriosis take up to around 8 years in this country to be diagnosed. They're sometimes not believed and they're told that their pain is just a period pain. That is not acceptable. They need to be supported, not ignored.
Life with endometriosis is really tough. It's been a hell of a struggle. I'm 25 and I've lost a ton of mobility and ability and energy in the past, say, 2 to 3 years. And it just gets worse and worse and worse. And it's tough not knowing if it's gonna get better.
Miriam's decline in health is affecting her whole life. A passionate singer, her symptoms are so severe, she's no longer able to take to the stage.
Her mom was an opera singer, so you can imagine the kind of lungs that come from an opera singer. She can definitely belt out a tune.
You can tell by the way I use my walk. I'm a woman's man, no time to talk.
Look at you. I'm so confident and happy. It just looks amazing.
I've lost a lot of kind of physical ability and also just been through a lot which affected my ability to sing.
Miriam's life has been turned upside down, and in the last few months her symptoms have got worse.
I've been experiencing intermenstrual bleeding, so bleeding between periods on and off for like about half a year, which had been really concerning as well. So it's kind of like everything had come to a head. My belly does not usually look like this, but this is the kind of bloating that I see.
To help explain why her tummy is distended, Mr. Kazali wants to show Miriam the inside of her uterus.
That is a sign of adenomyosis. That's when endometriosis grows inside the muscle of the uterus, causing inflammation and abnormality there. And you can see how it's also pressing on the endometrial cavity. That's what has changed the size of your uterus. And that's called an adenomyoma. That's adenomyosis inside that muscle.
You look at that and you think, how could you carry a baby in that?
This is one of the reasons why there will be issues with fertility.
Thought of as the cousin of endometriosis, it is possible that adenomyosis contributes to fertility issues because of the changes it brings about in the uterus, though more research is needed.
It's quite shocking, really, to see that the kind of space that I have inside my uterus, like the normal part, is just such a tiny sliver of what of what it should be and is just so compressed. It really looks wrong, doesn't it?
Miriam's endometriosis is so severe, multiple cysts have swollen her ovaries, expanding them to 5 times their size.
This is what's inside your ovaries. This is what's been causing them to be enlarged. Shaheen, what are we looking at?
So these are called endometriomas, or chocolate cysts. So each of these little round-shaped things that you're seeing are inside your ovary, making it bigger, expanding it. They are full of old blood. It will look like melted chocolate, and that's why they're called chocolate cysts. And you can see that you have quite a few.
Oh, it's a grim imagery.
When I first heard about the terminology of like chocolate cysts and everything, it's so weird and off-putting, and it's so hard to kind of understand what they are. But when you think of it, it's like just kind of bleeding into yourself and scabbing and over and over and over again. Am I right in thinking
That's
that?
right,
Yeah.
yes.
These blood blisters, which are covered in fibrous tissue, known as chocolate cysts or endometriomas, can be found in between 17 to 44% of women with the condition. They are often associated with the severest form of the disease, stage 4 endometriosis, which Miriam has been diagnosed with.
You have at least 7 or 8 in each of the ovaries.
Is that a lot?
That is a lot. So you can have endometriomas that are very much larger than this, but in your case, the challenge is you have multiple smaller endometriomas.
You can see why it's so disruptive.
Yeah, it seems
Can't
like
you?
very rough
Yeah.
and even just one.
It's quite scary. It's hard because it's a part of you and it isn't right, and there is something going wrong inside.
You know, when she first got diagnosed in the hospital, they just said, oh, it's involving not only the uterus and the ovaries, but the bowel and the bladder and the intestines. And it was hard to determine, okay, well, what kind of doctor do you go to for this?
But Miriam is about to see in 3D another reason her condition is so severe. A nodule that has fused more of her pelvic organs together.
We call it rectovaginal endometriosis.
So it's kind of everything here just stuck together.
Yes.
And for the sake of her health, Miriam has to come to terms with the best treatment option open to her.
I'm scared about the prospect of having major surgery.
Chronic pain like Miriam's can be controlled to some degree with medication, but sometimes physical and emotional relief can come from unexpected sources. Dr. Karan Rajan explains how chemicals in our bodies can be released when we are around our pets.
When you pet a dog or a cat or any animal, that sense of touch releases serotonin and dopamine. Serotonin is one of the happy chemicals. It's involved in sleep, mood, appetite, memory, and dopamine is a reward chemical. It's involved in the sensation of pain, pleasure, and emotional regulation. So petting an animal not only boosts those two brain chemicals, it actually lowers the stress chemical in your brain.
With the aid of our groundbreaking 3D technology, doctors are able to offer a greater understanding of our symptoms and conditions at a glance.
Ah, you must be John and Sue.
Hello.
Hiya,
Nice to meet
Let me
you.
sit yourself down.
59-year-old John, accompanied by his partner Sue, has come to our imaging centre to understand not just his diagnosis, but also the best course of treatment for it.
You know, you're clearly a pair that are full of life.
The couple has shared more than a few laughs at their home in Basildon, in Essex.
I told the wife that I'm going to make a car out of spaghetti. Well, you should have seen her face when I drove past her.
It's terrible.
I'm a bit of a joker, and I just tell jokes on social media, and people love it. I've got 10,000 followers. And some of the comments I get are really nice because they actually say to me, do you know what? You've made me smile, you've made my day. Every single day I look out for your jokes. Sue thinks I'm a bit nutty doing it.
He sometimes acts a bit silly, but he's just got a heart of gold.
But recent bouts of crippling pain in his left side has meant life is no longer a laughing matter.
I started having pains 3 months ago. I'd gone out for a walk, my back felt bad, I was aching right on my left-hand side. I was absolutely in agony. The pain was the worst experience I've ever had. We phoned up the doctor so I could get some painkillers, and the next day I was crying my eyes out. In the end, Sue phoned up for an ambulance, but they didn't send one down.
You could see in his face how much pain that he was in at the time.
I was scared.
Acting quickly, Sue drove John straight to the hospital.
They rushed me straight into A&E, and the doctors diagnosed kidney stones.
Kidney stones affect more than 1 in 10 people aged 30 to 60 and can develop when we aren't drinking enough water. These stone-like lumps form when waste products in the blood crystallize inside the kidneys. Usually, we pass these crystals when we urinate, but in severe cases, larger stones form.
It's frightening because if this kidney stone gets bad, could he die from it? Could there be an infection that he could get?
John's condition was so severe he was hospitalized, and doctors feared his kidney stones had caused a potentially fatal blood condition, sepsis.
So the fact that they first thought about sepsis shows just how physically ill you were, because that is an extremely serious condition too, isn't it? Life-threatening. So what was their initial way of establishing that you had these stones?
They actually gave me a scan, first of all.
You're going to have the chance to look inside your own body, to look at the kidneys. What do you hope to gain from that?
An insight into why these kidney stones have actually caused me all the problems.
John knows he needs surgery to correct his problem, and he's hoping Mr. Anil Vora, consultant neurological surgeon at Basildon and Thurrock University Hospitals, can explain his diagnosis and the procedure needed to get him better.
Good morning.
Hello.
Hello, John.
Hello, how are you?
John, if I follow you, let's go into your consultation.
Using John's own medical scans, Mr. Vora is about to show him in 3D his own kidneys and bladder.
Let's flip the visors down on our headsets and take a look at what you can see. Now remember, John, this is your body.
Wow.
We're looking inside your skeleton.
It's unbelievable.
You have the ribs and inside at the back. The kidneys are way back behind. Most people think the kidneys are lower down, but you can see that. That's the 2 kidneys on either side.
The main function of the kidneys is to filter our blood, turning the waste into urine, which travels down tubes called ureters to the bladder and then out through the urethra.
See that in 3D? Wow.
Did you know that your kidneys and your urinary system look like that?
No, I had no idea.
Aha.
So, John, now you see here, just a magnified view, you have the 2 kidneys on either side, and you notice on the left side, it's a bit more swollen than on the right side.
The top of the ureter that goes into John's left kidney is stretched and swollen.
That shows that there's something blocking that tube.
John's kidney stone is obstructing the flow of urine from the kidney, which puts him at risk of infections.
And there you see the culprit.
It is just, it looks like a rock. It's the only word that I can describe it.
For the last 3 months, passing urine has been a painful and frustrating experience for John.
So how are you feeling today?
I can't urinate properly. I'm getting sickness, and I'm just constantly in pain.
Are you still getting the burning sensation down there?
The burning sensation is there all the time. I just want to go normal. I just want it to flow out. I know it's embarrassing, but I just want it to flow like a normal person does.
In our imaging centre, Mr. Vora wants to explain to John why he's having so much trouble passing urine.
So that's a stone in the ureter. And normally the ureter, if you see on the right side, is about 4 or 5 millimeters in diameter, whereas this stone is about 7 to 8 millimeters.
Why is that causing so much pain?
The body is trying to expel the stone, but because of its size, the ureter is going into what's called spasm. And that spasm is causing not only pain, but it's also causing blockage of your kidney.
The stone is twice the size of the ureter, the tube that it's blocking, effectively bunging up John's kidney with urine, causing him terrible pain.
I wish it would just pass. I didn't realise that kidney stones can cause that much problems.
And after labour pains, this is one of the worst pains people can experience.
Wow.
The stone blocking the ureter has broken off from a much larger one, which is nearly 10 times the size and is sitting inside John's left kidney.
What is that?
So we're looking at a stone which is branching off into one of the calyx, which is one of the cups in the kidney, and then coming into the renal pelvis, which is the main bit. And it's filling up probably a third of the lower half of the kidney. The horns, just like a stag's horns, they're growing in there, and that's how the name staghorn came for these stones.
Staghorn stones are the biggest kidney stones that patients get. They have an uneven shape with branches that attach to the kidney's walls. This makes them especially challenging to remove.
Oh my goodness. That's humongous.
That's nearly 5 centimeters.
Wow.
And probably the stone in your ureter has broken off from this stone and traveled all the way down and got stuck there.
Oh my goodness.
So all of this is all kidney stone?
Yes, yes. You can see it is like a horn growing out of a body.
And yet the source of the pain isn't there, is
No,
it?
the source of the pain is because there's a blockage in the pipe. Like you have an overhead tank, when you block the pipe, there's an overflow, and that's why the kidney cries, because it gets distended.
Thankfully, John's right ureter is clear of blockages, but Mr. Vora has identified a second staghorn stone inside his kidney. Having stones in both kidneys is not only rare, but also complicates treatment.
So this is even bigger than your left kidney stone. But you're lucky because they're all still in the kidney.
Okay.
That's why you've not had pain on your right side.
So not only has John had all the problems on his left side, this is going on in his right kidney.
Yes, that's right.
So what sort of size is this, Anil?
This is nearly 7 to 8 centimeters.
It's unbelievable. The size. They're shocking.
You rarely see people having bilateral big kidney stones. Usually you see one stone on one side, but a combination like this is very, very rare. Probably I've seen only 2 or 3 in my career.
Left untreated, stones of this size and shape can be life-threatening.
These stones, because they have millions of bacteria in them, they eat away the kidney tissue, and patients can land up in kidney failure.
So I was lucky to catch it when I did.
Yes, absolutely.
At the hospital where John was first treated as an emergency measure, he was fitted with a temporary stent, a tiny silicone tube in his ureter, going up to his kidney.
So you can see the stone. The stone is bypassed by the stent. So what the stent is doing is it's allowing all the urine from the kidney to drain into the bladder while you wait your surgery.
Wow. I didn't actually realise that what the actual stent was for.
In a sense, the stent was potentially life-saving as an emergency measure then.
Yes.
John knows that his only hope is surgery, but for him, it's not the easy option.
Just have to wait and hopefully that operation will be soon. I'm nervous about it. I really am worried. What is he going to do to me?
Well, you're going to find that out soon, but for now, you're just going to have to live with it, I'm afraid.
Now, Mr. Anilvora wants to allay John's fears about the procedure, which will offer him a more permanent solution to his painful problem.
We can clear the stone through keyhole surgery. It's quite complex, but very challenging.
Because the procedure is so complicated, John will undergo 2 bouts of surgery, 1 on each kidney. Sue finally has the chance to make sense of why she had to rush John to the hospital.
That's it.
That's what brought John to the casualty department. That tiny stone is the culprit. When we did the scan, we then found not only a stone in his left kidney, he's got an even bigger stone in the right kidney.
So can't you do both of them together and so you have to wait?
Unfortunately, we have to allow his body to heal, even though it's keyhole, but it's a big operation for him to undertake. So normally we would allow 6 to 8 weeks between the 2 operations.
What did it feel like to see that? Because
it's horrible. It's horrible knowing that is in his kidney, and that's caused a problem.
The positive news for John is that Mr. Vora will be removing the painful blockage and the staghorn stone from John's left kidney in 2 weeks' time. Do you feel more ready to take on the surgery now?
I am. I'm excited now.
Good. That should be the spirit. You see people with big stones, but having bilateral stones in both kidneys and then having a stone in the tube, ureter, it's very unusual.
We're more likely to develop kidney stones if we don't drink enough water. But how can we tell when we are dehydrated? Here's Dr. Karan with some answers.
As a doctor, I'm obsessed with dehydration, and for good reason. It can be problematic and it can basically affect every organ going. Dehydration doesn't just make your mouth dry and make you feel thirsty. There are some unusual signs of dehydration. Weirdly enough, you might be left craving something sweet. The reason your body does this is because you're so dehydrated, your liver struggles to break down its glycogen stores into glucose. This means that you have a lower blood glucose. Water in your body has multiple uses. One of the uses is actually in your eyes to make tears. Tears lubricate and clean your eyes. So the more dehydrated you are means less water for your eyes, means drier eyes that are more irritable. Dehydration can also cause dragon breath. When you're dehydrated, it means you have less saliva. One of the roles that saliva has is actually to keep a check on all the oral bacteria. Less saliva means a potential overgrowth of all sorts of bacteria, which could lead to funky breath.
Earlier at one of our imaging centres, Miriam saw in 3D how endometriosis had affected the walls of her uterus.
That looks really bad.
Chocolate cysts have made Miriam's ovaries swell to 5 times the usual size, and now she wants to delve deeper into her diagnosis.
I was really relieved that I finally had a clear answer to all the pelvic pain and all of like my heavy periods and everything. So it made sense when I was finally diagnosed. People have told me that it's probably psychosomatic, so it's probably like the pain's all in my head basically. So seeing my endometriosis in 3D could be quite validating for me to finally have proof that there is something really bad happening.
I remember her saying like, oh, they think it might be mild. Oh, they think it might, you know, it might be more extreme. And each level kind of getting more and more and more severe till that final diagnosis of, oh, we think you have stage 4 deep infiltrating endometriosis. So it was, mind-boggling.
Now Mr. Kazali wants to explore the area of Miriam's endometriosis that is responsible for many of her symptoms.
Let's concentrate on that area between the rectum and the vagina.
If you come over here, look, have a look at that bit there.
So this is an endometriotic lesion. So that's the area where, over a long period of time, the inflammation and the bleeding has happened, and it has caused the scar formation, turning it into this disease. We call it rectovaginal endometriosis. That's because it sits between the rectum and the top of the vagina. So that basically just pulls all the tissue together.
So it's kind of everything here just stuck together.
Yes. You can imagine that the scar formation as the epicenter of the whole problem.
Over the past few years, it's gone from being something that was painful, but I could still be like an overachiever and work really hard at school and get into, you know, the university I wanted to go to and participate in all these crazy extracurriculars and go dancing and go to dance classes. And I just look back and I couldn't do that now. I just don't know who that girl is who did that. It begins to make sense how it would cause that pain.
But there's also inflammation. There's also the fact that the nerve endings may be affected.
To see it just makes me so aware of what's happening inside, and like the reality of it being so bad is really, well, it makes me feel like I'm not crazy anymore.
When you see that, you see, okay, something has to be done.
Yeah, like that can't be left.
You can't ignore that anymore,
Can't be left that way.
No.
The best treatment is surgery to cut away the chocolate cyst, but doing so damages the normal ovarian tissue and reduces the ovarian reserve. So that's always a dilemma.
So that's tough, isn't it? Because there, your treatment, one of the flip sides is that it actually reduces your ability to bear children.
We made the decision together that it would make sense for me to do so embryo freezing. So rather than freeze my eggs, because I'm in a same-sex relationship, I'm not, you know, likely to get a boyfriend in the future who's gonna, you know, fertilise my eggs. It was better to go through the entire process now. So basically, I went through IVF a couple of months ago. So from initially, you know, like 15 eggs, I ended up with 3 embryos. So I've got those in a freezer, but I've only got those 3 embryos. It's taken a really big chance to kind of bet on my body to be able to manage that. And
yeah, I totally hear you.
I'm in so much pain that, even if I wanted to have a kid now, in this much pain, I don't think I could raise a child. But I'm scared about the prospect of having major surgery.
The area of endometriosis that is around the bowel, the rectovaginal nodule, we are hopeful to be able to remove the whole nodule, the whole disease, which means cutting around the tissue and then repairing the defects. Also, I would expect to see a lot more in other areas of the pelvis. So the plan is to go and remove all of the disease in the rest of the pelvis.
Although it's a highly technical procedure, cutting away the painful nodule and the other affected tissue could be life-changing for Miriam.
Even if I have the surgery and everything goes well, like there's potential nerve damage, there's potential damage, and my fertility might be damaged as well, really badly. And I don't know if that's going to come back, and it's just really sad that it's gone to this point. And the fact that I've fought so many doctors and pushed back, like if you're quiet about this, you're just never going to get diagnosed. You have to fight and fight and fight in order to get a diagnosis, because so much pain that we call women's pain or women's issues is just totally overlooked by everyone.
I'm hoping to be able to get rid of most of your symptoms after the surgery.
That's reassuring. You know, I trust you, and if that's what you're telling me, that's what I take away.
right?
I think so. That was pretty intense. I feel sort of relieved, but also just like shocked.
Has it helped to convince you to go ahead with the surgery?
Seeing this is definitely made it a lot clearer that this is what I need to do. It is hopefully going to be the first step for me being not necessarily pain-free, but at least reducing my pain. If I go down from a daily 7 out of 10 to like honestly, even a 6 out of 10 I'd take at this point.
I think for Miriam, seeing what endometriosis had done for her body was almost like approval, because she'd had a lifetime of trying to get people to listen to her problem. And I think it's allowed her to continue on a path of trying to find the right solution for her.
Just 2 weeks ago, John was confronted with his own large kidney stones.
After labor pains, this is one of the worst pains people can experience.
Wow.
Now, armed with knowledge about the treatment, John is ready for the first of 2 keyhole surgeries.
Seeing the kidney stones in 3D, it did actually frighten me because I didn't know what was going on in my body. But now I've got a little bit of confidence. I know what he's actually going to do in the operation.
Just as John saw at our imaging centre, today's procedure will be on his left kidney. First, the stone blocking his ureter will be broken up by a laser. Next, the 5-centimetre staghorn stone on the inside of the kidney will be tackled with pulses of high-pressured air.
Hopefully they'll be able to do this job as quick as possible, and then I will actually be out of pain.
The procedure will be carried out by consultant urological surgeon Mr. Anil Vora.
Once he's put to sleep, we then put a telescope in and hopefully laser the stone out to dust. So if you look on the X-ray monitor, you can see there's a big black blob, which is the stone. So this is the inside of the ureter. So you can see the stone here. Dim top lights, please. Okay, laser on.
First, Mr. Vora is tackling the stone lodged in John's ureter, which he will break into smaller fragments using a laser guided by a scope.
So you can turn up the energy. That's coming very nicely. So the first bit is over. We've cleared the stone in the ureter. So that's the end result. It's all dust.
Mr. Vora removes the powdered kidney stone using a suction device before moving on to the 5-centimetre staghorn stone lodged inside John's left kidney.
You can see on the monitor, we have entered the kidney with the telescope. So that's a stone. So now what we'll be using is an energy device. We fire it. So it's basically using compressed air driven at the tip of an instrument. So we have broken the big staghorn.
As well as suctioning out the larger particles of debris, Mr. Vora will fit John with a temporary stent, which will allow the kidneys to flush away the finer fragments.
Okay, final check. So you can see on the X-ray, we're looking at the kidney. You can't see any black spots, which may be stones.
With all traces of the staghorn stone gone from his left kidney, John will spend the next 3 days recovering in hospital.
These are the stones which we really need to attack because we need to get them out, get people better, because these stones can destroy kidneys.
Five weeks earlier, in one of our imaging centres, Miriam, with her partner Maddie, was confronted with her endometriosis, a condition that's been causing her pain for more than a decade.
Love you, baby. I love you too.
At the Lister Hospital in London, preparations are underway for Miriam's long-awaited keyhole surgery.
I need this surgery, I need it, because the pain is getting totally unbearable, like it's untenable at the moment. I'd been told before that I could possibly just try taking hormones, go on the pill, take lots of painkillers and kind of see how I go. And I think seeing what's really going on inside made me really aware that that is not an option for me.
Miriam's surgery will be performed by consultant gynecologist and endometriosis expert, Mr. Shaheen Khazali.
My practice is almost exclusively severe endometriosis now, so we're used to difficult surgery. Miriam's case has its own challenges because of the size of the uterus and the access, because we're dealing with quite a few different sites of pathology. It's going to be challenging from that aspect. Knife, please.
A specialist in minimally invasive surgery, Mr. Khazali makes tiny incisions in Miriam's tummy and inserts a camera into her abdomen.
So we can immediately see evidence of endometriosis everywhere. That's exactly what we'd seen with virtual reality. It's as if I've seen this before.
Just as Miriam saw in our imaging centre, her endometriosis has fused her ovaries to the surrounding organs. Once Mr. Khazali has released them, he will remove the chocolate cysts inside. Next, he'll treat the pelvis and the worst affected area, the nodule of diseased tissue between her vagina and rectum.
So we've got a very clear nodule. We can see this red and white abnormality. It's going much deeper than the surface.
First, Mr. Khazali wants to free the ovaries which have become attached to Miriam's surrounding organs.
All right, so the ovaries, they are completely stuck behind the uterus, and they're also stuck to the bowel. So we're going to start mobilizing the left ovary.
Releasing them is a very delicate part of the procedure. Mr. Khazali is keen to avoid any damage to the ovaries or the organs they've become attached to.
Everything is really stuck. Completely. We've got the right ovary stuck to the rectum. That's free now.
With the ovaries separated from the rectum, Mr. Khazali makes a small incision in them to clear the insides of the multiple chocolate cysts.
We're going to now go through the whole of the ovary and remove all of the abnormal cysts. If it's brown inside, then it's an endometrioma. Okay.
With both ovaries cleared of the chocolate cysts, Mr. Khazali begins operating on the bladder and the bowel.
Here's some more disease. So we're slowly separating all the abnormal tissue from the normal, removing the endometriosis from various parts of the pelvis. It is quite thick and deep. Look at that.
After removing the remaining endometriosis from the organs in the pelvis, Mr. Khazali is moving on to the vagina and rectum. The disease has affected the full thickness of the top of the vagina and the outer surface of the rectum, and it's these two areas which are responsible for many of Miriam's symptoms.
So that's the vaginal nodule, and I think that's most of the volume of the disease. This is where we are going to do our partial vaginectomy.
This partial vaginectomy involves removing a 2 to 3 centimetre area of the vagina, where Miriam's large nodule of diseased tissue is.
That is on the rectum. If I can go here, then we've won. Okay, give me the scissors. That's the nodule. Let's see. If I do this, that probably will separate it. Now we are opening the vagina to get the whole nodule out. Look, you know, this is coming off nicely. Yeah. Okay, so we have now shaved the endometriosis from the surface of the bowel, and we should now have all of the disease, and we're done.
Miriam's surgery has run smoothly, but she still has a 6-week recovery period.
It wasn't an easy operation, but it all went really, really well. Sometimes it takes a bit of time for us to be able to see the full results, but I think it's very likely that she will see very significant improvement in her quality of life.
In 6 months' time, Miriam will meet up with Mr. Khazali to check on her progress. In Essex, it's been a month since the first of John's 2 surgeries to remove very large stones from his kidneys.
I'm feeling really, really good. Since the operation, I felt absolutely marvellous.
And he's a lot happier in himself as well. He's doing a bit more than what he normally does. He's sort of like doing housework now.
Before his second operation can be scheduled, John is seeing consultant urological surgeon Mr. Anil Vora for a checkup.
Hello, hello.
How are you?
Hello. I'm fine.
I've got a few questions I want to ask him about the stent, about his stones, what kind of stones were they?
Your operation just went as per the books. It couldn't have gone better.
Lovely.
But generally, your recovery is on as planned?
Yeah.
You're doing well.
Thank you.
Good. What about your pain?
I had a little bit of a funny feeling, but it's now gone. So
okay.
That was when I first had the stent in, but I was just worried about the blood in the urine, but now that's all gone.
But that's normal because of when you shatter the stone into debris, when you clear those bits, you can pass a bit of blood. It's quite common, yeah.
Okay.
Did the stag on, did it go into his kidney?
Yes.
So it's left a sort of like a mark there?
But the good thing is the body is very good at healing.
Yeah.
It's not caused long-term damage, so his kidney should recover almost 100%.
With no complications arising from the surgery on John's left kidney, Mr. Vora wants to discuss phase 2, the procedure to remove the other staghorn stone from his right kidney.
We have closed one chapter. The second chapter we will have to open.
And I think I know what I'm in for.
I know the right side will be a challenge because it's a much bigger stone. It might mean a slightly prolonged operation.
It sounds odd, but I'm looking forward to the next operation.
And you'll be hearing from the hospital soon for your next procedure.
Lovely.
If you keep a balanced diet with lots of fluids and keep yourself well hydrated, you're minimizing the chance of stones coming back. Change your lifestyle so that you don't have to see a urologist again.
No.
Just 2 weeks after his first bout of surgery, and John has already made some big lifestyle changes.
Got to make sure we get the right balance of what he eats. Make sure he does a bit more exercise as well, because I think the exercise is important. We've got a positive outlook on life.
I'm looking forward to getting out now, getting back to normal life. We've gone out for a walk at our local park, something I haven't done for over 4 months, and you know what? I've enjoyed it without having the problems of what I did before.
Yeah.
Of being, brought out.
All my back. Got to sit down.
Yeah.
Got pain.
Pain-free, without any worries whatsoever. If I wanted to, I could do a run down that road. but I'm not going to.
Oh, I'd like to see that.
Life is pretty good at the moment because I know that I'm moving on and carry on with my life the way it was before. I'm so glad that that one kidney is now sorted. I'm relieved on that one. I'm now prepared for my next kidney operation. And to be honest, I'm looking forward to that as well now.
And I'll support you through the other one.
Hello.
Hey.
So nice to see you.
Yeah, nice to see you too.
In London, 6 months after undergoing major surgery for her endometriosis, Miriam has a follow-up with her surgeon, Mr. Shaheen Khazali, accompanied by Dr. Goody.
Hello.
Hi.
How are you?
Yeah, doing all right.
Please have a seat.
Hello.
Hey, how are you? So how have you been since surgery?
My pain is much, much better. So I've gone down from like the daily pain of like a 7 or 8 to probably around a 3. Like I'm still in pain,
okay.
but it's much less.
Sounds very encouraging. The challenge with endometriosis surgery, particularly when it's severe like yours, is to heal away the abnormal tissue without injuring any important structures. And in your case, nothing was injured and there was no complications.
Thinking about the future, what happens next?
I know from talking to other people with endometriosis that often it is something that comes back and they have to have multiple surgeries throughout their life. Do you think I'll need surgery again? And if so, do you know when?
It's difficult to know. You're young. You have many years until you go through menopause, which is the time that, generally speaking, endometriosis starts to dwindle. So chances are that you may need further surgery, but I hope not anytime soon.
Okay, nice.
What do you think is the biggest change? So if you look at yourself now and compare it to before surgery, what do you think has changed the most?
I would say my energy levels. I'm able to do stuff. I can go to work every day and then also do stuff in the evenings. I can be active and do things on the weekends as well.
And painkillers, do you still have to take them?
No.
No.
Since having the operation to remove the cysts and tissue damage by endometriosis, Miriam is feeling the full benefits of her treatment.
There were times in the past where my life was so controlled by pain and fatigue. I just could never imagine being able to go out and do things again. Yeah. I know my endometriosis isn't cured. It's not completely gone away. Like, this story is never going to be over. But to be at the point that I am now and able to go and like live my life and just feel happier and enjoy things again it's such a privilege. Like, I feel so lucky.
Baby, come on, come on, come on, come on, come on, come on. And spin.
Having suffered in pain for more than half her life, Miriam is finally able to get back in the groove.
I wasn't able to sing for ages and ages, which is something I used to do all the time. And now I've joined a choir, and I'm singing every single week. And my voice is getting so much stronger, which is really nice. But Nadia has to put up with me singing all the time in the house. I'm so happy that I have you.
Need help nodding off? BBC Two tackles a common but serious problem with life-changing bedroom hacks this time tomorrow. How to sleep well with Michael Mosley, brand new at 9. Now Alison Steadman is our star judge. It's the main event. Great British Menu Finals Week continues next.
8 celebs.